I was hoping you would explain more, because I think this is really important, the issue of the community pricing. Because I don't think people realize that our young people are subsidizing the cost of health care. Young people who are the poorest are subsidizing the health care for our older population who are the richest. It's like a kind of reverse that people don't understand.
It's like HMOs are perverse. I mean, the incentive for an HMO is to control actually providing care rather than providing it because they want a better bottom line. Yes, as I mentioned earlier, young people see health insurance as a bad idea. But those young people that do buy health insurance and coverage, they're subsidizing those people. And a lot of those people, because our health care is expensive, because people are overusing the system, because they think it's free, because they get it from their employer. John Shattuck just told me the other day that, you know, a friend of his said, well, he had to take the day off work. And he said, well, why? And he said, well, I'm going to the doctor. And he said, well, what's wrong with you? He said, well, I have a cold. And he said, Shattuck said, well, it doesn't seem like you have a cold to me. And he said, well, I have a cold and I have health insurance and I don't have to pay and I'm going to the doctor. So, you know, a lot of older people are overusing the system. In Canada, a lot of people went to the doctor because it was an outing. They weren't sick, but they were, you know, alone. And that kept really sick people from being able to see the doctor. So we have a problem. If we can change the system, change the tax code, young people will be able to get the type of insurance that fits their needs, and therefore they will get insurance because it'll be cheaper.